Feeling stressed or afraid after a traumatic event is natural.
And for most people, symptoms eventually subside.
But if they don't, you may be experiencing PTSD.
PTSD stands for post-traumatic stress disorder.
It's basically exactly what it sounds like.
You experience extreme stress or fear, even when you're not in danger, after having faced a trauma.
You may re-experience the event through flashbacks or nightmares, accompanied by physical symptoms like sweating or a racing heart.
You might avoid people, places, activities, and situations that might remind you of that event.
And you may feel constantly on edge or prone to angry outbursts.
We often hear of soldiers developing PTSD.
It's important to point out that trauma doesn't necessarily mean danger.
Trauma can happen to anyone.
Certain events, like the death of a loved one, can cause PTSD.
Thankfully, PTSD can be treated. In some cases, it doesn't require any treatment. Your symptoms may go away over time.
But in other cases, treatment like cognitive behavioral therapy and medication can be very effective.
The first step is to talk to your healthcare provider, because together, you can develop a plan that works for you.
We all experience shifts in our mood.
Sometimes we're up, sometimes we're down.
But occasional mood changes in bipolar disorder are very different.
For most people, a shift in mood might last a few hours.
But if you have bipolar disorder, the shifts can last for days, even weeks.
Often with huge changes in your behavior.
These are called mood episodes, and there are two main types.
Manic episodes are often characterized by extreme elation, as if nothing can ever go wrong.
You're high on life.
Or you may feel so wired and energized that it's actually uncomfortable, and you feel like you have more energy than you know what to do with.
Depressive episodes are the opposite. You may feel extremely sad or hopeless.
You may be unable to sleep or sleep too much. You might even contemplate suicide.
There are also episodes with both manic and depressive symptoms. These are called episodes with mixed features.
You might feel sad and empty and simultaneously feel intensely energized.
In each case, bipolar mood episodes can be seriously disruptive to your life.
The type of bipolar disorder that you're diagnosed with is based in part on the type of episodes you experience. Thankfully, you can live a full, healthy life with bipolar disorder.
Each type is treatable, even the most severe forms, generally through a combination of psychotherapy and medication.
The first step to taking control of your bipolar disorder is to talk to your healthcare provider.
Together, you can develop a plan that works for you.
You might often hear people say, "Oh, I'm so OCD," if they are particular about certain things.
But being particular and having obsessive compulsive disorder are very different.
We all do things repetitively from time to time, and we sometimes have all-consuming thoughts.
The difference is that for people with OCD, obsessive thoughts are constant and compulsive behaviors need to be performed exactly.
Not doing those behaviors cause you serious distress and disruption. It works like this.
An obsession, like having things in perfect order, causes anxiety.
In response to that anxiety, you feel an urge to do a repetitive behavior. For example, like excessively checking to see if you locked your house or your apartment before you leave.
But if it doesn't happen exactly the way you need it to, you may find it hard, even impossible, to function until it does.
And it happens over and over and over again.
If you have OCD, you may recognize this as excessive, even nonsensical,
and still be unable to control your actions, and it can take up hours of your day.
Thankfully, OCD can be treated, usually with medication, psychotherapy, or both.
If you think you have OCD, the first step is to find a healthcare provider you trust. Together, you can develop a plan to treat and manage your OCD.
Feeling sad every so often is not the same as having depression.
Everyone feels down sometimes. That's part of life.
Maybe you failed a test, or you lost a loved one, or you were let go from your job.
Even watching the news today can send you in a spiral.
Feeling sad after situations like these is expected. That sadness is not the same as having depression.
With depression, you're persistently sad, and the things that interest you are no longer enjoyable.
You may be unable to sleep, or you can't stop sleeping.
You may feel worthless and feel like there's no hope, that it won't end.
In some cases, you may even feel suicidal.
In order to be diagnosed with depression, symptoms must be present for at least 2 weeks.
Thankfully, even the most severe cases of depression can be treated.
It's usually treated with medicine, psychotherapy, or a combination of both.
The first step is to see a healthcare provider.
Together, you can develop a plan that works for you.
Feeling anxious from time to time is different from having an anxiety disorder.
We all feel anxious every once in a while.
Anxiousness is a completely understandable reaction to stress.
Yet an anxiety disorder is different from occasional anxiety.
You may feel constantly nervous or feel a dread you can't quite shake.
But there's also physical symptoms as well, like an increased heart rate or hyperventilation or trouble concentrating.
These feelings can be all-consuming. They might not go away. They might feel really excessive, and they prevent you from living your life fully.
You might avoid things that could trigger your symptoms, and everything from your job performance to your physical health can be affected.
Anxiety disorders are relatively common. In fact, nearly 30% of adults will be affected by one at some point.
Thankfully, they're also treatable, usually with either psychotherapy, medication, or both.
The first step toward treatment is speaking with a healthcare provider.
Together, you can develop a plan that works for you.